Hello, welcome to my channel. I am Dr. Pepple. I'm a medical doctor here in the UK. Basically, I do videos for international students and international medical graduates who are transiting to work or school or practice in the UK. So I offer tips and advice on how to go about settling down properly in the UK. I also do medical lifestyle videos and also some inspirational stuff. On today, specifically, I'm going to be talking about jobs that are available for international medical graduates. Today's video is going to have a different approach, different from what I've done before. So it's going to have an outline. First of all, I'll start by giving a general overview of jobs available in the UK. I'm going to talk about types of jobs that are available for international medical graduates, and also talk about job titles and roles, so you know what exactly you should be applying for when you're ready to apply for jobs in the UK. And I'm also going to talk about a bit on job applications, what to look out for and how to help you pattern your CV properly so it becomes very marketable. And if you're new to my channel, please just subscribe, hit on the lower right hand corner and subscribe on that subscribe button, and also hit on the bell notification so you'll be the first when there's a new video. All right, so let's get straight into it. It's quite exciting, you know, when you've gone through the rigors and stress of passing English language exams, which is IELTS or OET, whichever one you've done, PEPPLE'S exams, and getting your professional registration with the GMC. The next thing is jobs. And I mean, people get a lot of conflicting information from either people who've done it already or people who are already in the UK. Some tell you, oh, it's quite difficult to get a job. Some tell you, oh, it's quite easy. So I mean, people tell you things based on their experience. I personally like to tell people things from an optimistic point of view, because I know it always worked for me. So to start with, there are generally 3 types of job you can do as an international medical graduate. So you can work with the private sector, NHS, with your National Health Service. You can work as a locum doctor. All these job titles are based on your immigration status, your clinical experience, and your personal preference, and especially what jobs are available at the time that you want it. I mean, how desperate are you to take up any job that comes your way? So we're going to be talking about them one by one. Let's start with the private jobs. Most times when you are doing the last part of your PEPPLE'S exam, some private agencies might approach you to ask if you are interested to work for them. I don't know if that happens anymore, but when I was doing my PEPPLE'S exams, that was the most occurring thing. So some agencies approach you and ask if you're willing to work for them. So what they do is they recruit doctors to work in the private sector or even in the NHS. Most of them have a rota system where you work 1 week on and 1 week off, or you work 2 weeks on and 2 weeks off. So the week you're on means you are literally working 24 hours a day for 1 week. But let that not scare you. You have a coordinated staff of nurses and healthcare workers and other senior doctors. So you're literally not working every hour, but you are supposed to be on site for the 24 hours every day for 1 week in case there's any need for your services. Mind you, almost all the jobs you will be doing are elective surgical jobs. So most of the surgeries actually happen weekdays, so your weekend most times are free. Not always, but most times your weekends are free, so you have time to yourself. The major advantage of this kind of job is quite flexible. So the week you're on, you know you are on. The week you're off, you got control of your time, so you can do whatever you want to do. You can go on holidays, you can travel, and you have time to study for exams, especially if you want to take any professional exams. Even the week you're on, and the weekends that might be a bit free, you still got more time to to study and to relax and do whatever you want to do. Apart from that, if you don't want to stay away the week you're off, you can actually inform the agency that you are available for some extra shifts, and they can fix it up to do some extra shifts, and that's some extra money for you. The only problem here is that you have to come back to work the next week without having any rest. So literally you're working week on, another week on, if that makes sense. But then again, it's one of the sacrifices you have to pay for the decisions you've made. Many people are against the private hospital jobs, because they tell you you haven't got exposure to NHS jobs and how the NHS works, which is quite true, because most times you are going to be the only junior doctor on site, so you haven't got communication or interaction with other doctors. The only doctors you get to see are consultants, and they don't have your time. They just come do their surgeries and go home. You are basically doing the peri-operative and the post-operative care of the patients, and when you run into trouble or if you're concerned about any patient, then you have to alert or escalate to the consultants in charge. So what many people do is they just take it as a transition job, just take it as something they have to do just for a period to get normalized before they dive into the main NHS jobs. Mind you, some of the private hospitals also recruit doctors for the NHS, so that means you are employed by the private agencies, but you are working in an NHS setting. So that gives you the advantage of actually working in the NHS setting. So now I'm going to talk about the NHS jobs. They seem to be like the bread and butter for everyone. They seem to be the gateway to everything in terms of your future ambitions and prospects. So that's why a lot of people will tell you go for NHS jobs. Looking at it critically, the NHS gives you, if you have an NHS job, it gives you that balance, that support that you need as a doctor who is just migrating into the UK. So you have time to integrate with other doctors from other nationalities. You get straight on to the medical conditions and problems that you see in the UK population. You start learning about how to bridge the gap between where you're coming from and what really obtains in the NHS, which is quite a fantastic thing, you know. And also there is that exposure to a whole variety of information, so you can start making an informed decision about how you want your future to go in terms of your medical prospect and in terms of either specializing. One other thing I need to let you know about the NHS job is that there are two types of NHS jobs. So there is the training and the non-training. A lot of people are so worried and concerned about training jobs. What I would advise is that if you're coming from abroad and you want to do an NHS job, the first thing you should do is to go for a non-training job. I mean, going for a non-training job gives you the opportunity to make mistakes and learn from them before you start your proper training. That's one. The second thing is that it gives you opportunity to have a balanced view of what specialties are available and what specialty that you might really fit into in terms of your preference, in terms of what ambition or what future prospects you are looking at, and also considering your personal skills. Because I feel that the choice of a specialty should be one that you've got the appropriate skill set to match up with your personality, as well as giving you that opportunity to enjoy your life afterwards. You know, you don't want to get yourself roped into a specialty that might be frustrating at the end of the day because you were ill-informed or because everyone else is doing. So it's important for you to get absorbed in the system, to get yourself integrated properly in the system, see how everything works, and make an informed decision. So the difference between doing a training and a non-training job in the NHS is that a training job basically is the one that leads you to final getting of a CCT, which is Certificate for Completion of Training. But if you stay in a non-training job, you are basically having the same job roles as those who are in the training job. The only difference is that the ones in training are advancing towards the CCT and you are not. Although there are alternative pathways for you. A non-training job might eventually also get you a CSER, which is Certificate of Eligibility for Specialist Registration, which basically is the alternative route for doctors who are not in a proper GMC recognized training program. So eventually you can still get onto the specialist register through a CSER route in the non-training job. One common denominator for private job and NHS job is both of them gives you opportunities to have your annual leave. So you can actually have annual leave both in private job and in NHS job. The other advantage which an NHS job has over a private job is that you can actually go on study leave on an NHS job, most of the study leave you go for are fully funded. So you apply for budget for study leave. You can attend courses and seminars and symposium that will enhance your knowledge and your practice, and most of them will be paid for because you have a stipulated budget for study leave in an NHS job, either training or non-training. However, that may not be the case in a private job. The other type of job that is available in the NHS generally is the locum job. So you can do a locum job either strictly, or you can do a locum job in combination with any job you're doing already. So if you are working in the private sector, you can use your time off, your week off, your days off to do a locum job in an NHS hospital. If you are already working in an NHS hospital, so you can also do a locum job in your particular hospital, your trust, or you can do a locum job elsewhere. So what you need to do to get a locum job is to register with other locum agencies. The other IMGs might have a British passport, maybe probably they were born here, or they have indefinite leave to remain. Those ones can opt to go for locum job. So locum job, basically you apply for a locum apply to a locum agency, you get employed, and you can be sent to different hospitals to work at a rate agreed between you and the locum agency. So most times you get your pay for that one either on a weekly basis or even on a monthly basis. It all depends on your terms of agreement. Now, what job roles are available in the NHS? So there are different job roles. F1 doctor, F2 trust grade doctor, clinical fellow, either a junior or a clinic or a senior clinical fellow, a consultant, or a specialty doctor, or an associate specialist. F1 and F2 are actually foundation year trainees. So if you haven't done internship in your country, then you will be qualified to apply for an F1 or an F2 job. But this takes a different pathway altogether, a different form of application. You have to apply through the United Kingdom Foundation Program Board. Most IMGs who are coming into the UK to practice would have passed their PEPPLE'S exam, so you most times will be eligible for either an F2 or an F3 position. F3 most times is referred to as a senior house officer. Sometimes if you are in training, you might be starting from a CT1 or an ST1 position. ST1, CT1 most times are also called senior house officers. Some ST2, CT2 are also called senior house officers. So registrar position basically starts from a C3, CT3 or an ST3 in most cases. You might also be employed as a trust grade doctor. A trust grade doctor, a junior clinical fellow, a senior house officer, most times are the same. It's just a matter of semantics. You might have the same job role, you might have the same salary structure, and most times these positions are also based on the years of clinical experience you've got from abroad before coming over. Some people might be employed as specialty doctors. So specialty doctors basically are doctors who have been in training in their countries or in other countries outside of the UK before coming into the UK. So you're basically working as a registrar in quotes in that particular specialty. The only thing is that you are not under a UK GMC approved training program. If you want to be in a training program, there are ways you can go about that as well, but that is not the focus of this video today. Some people can work as an associate specialist. So associate specialists are doctors who have completed all levels of training, but they are in a non-training job. So they cannot work as a consultant, but can work as an associate specialist. Now, in terms of job roles, like I mentioned earlier, the F1 is the lowest clinical job, is the start of your house job year. But for F2, SHO, for F2, F3, SHO, CT1, CT2, ST1, ST2, most times your job role is fairly similar or the same. So you're doing the job roles for a senior house officer. It is advisable for you to familiarize yourself with person specification for job roles, so you see exactly what competencies are expected of you if you are applying for jobs on that level. But what I tell people is that there is no need for you to rush into a job when you have not fully understood the demands of that job. You might not necessarily have to use someone else's situation to judge your present circumstances. So you have to do everything specifically tailored to your personal needs, I think. Now let's get to job applications, which is the sweet part. You've done all these things, you've done all your research, you've made your decision on what jobs you want to do. You have to apply. Apply first of all by setting up an NHS account. So you can set up an NHS candidate page account or an Oriole account, or you can apply through Track Jobs, or you can apply to the private agencies to get you onto the private hospitals. You set up the account and you fill up all the necessary information. Some people get frustrated when after 2-3 months they haven't got any job, and the minimum you can get a job in the UK is 3 months, and the maximum it can get you up to a year. But most times, if you do everything accordingly, if you apply to many jobs as possible, and if you present a very good CV, it might not really take you that long to get a job. The most important thing is to make sure you do everything you need to do right. And how do you do everything right? First of all, by tailoring your CV to the appropriate job you are applying for. What I advise people to do is you set up a generic CV, right, on the NHS page, and whatever jobs you're applying for, you make some little adjustments to that CV to meet the person's specification for that job. So the most common jobs anyone will tell you is emergency medicine jobs, general or acute medicine jobs, general surgery or urology or musculoskeletal or orthopedics and trauma. I think these are the very common jobs in the UK. Your CV has to reflect your competencies in these various jobs. That is the only way that you can easily get such job. So imagine a situation where you have been a psychiatric doctor abroad, and that's what you've done for the past 2 years, and you're applying for an A&E job in the UK, and you've loaded your CV with psychiatry. It might be difficult, it might take ages for you to get called up for an interview. Reason being that you haven't got specific, even though you're a doctor, you've done internship, you've done house job in Nigeria or Africa or wherever you've done your house job, which basically you've rotated, you've gone through the core surgical and medical specialties, but that's in the time past, and they're not even seeing that in your CV, so no one cares about that. What they care about is what they are seeing presently in your CV, which is psychiatry. So it's going to make it difficult for you to get a job in general medicine, surgery, or acute medicine, whichever be the case. So you have to tailor your CV to the particular jobs that you are applying for at the moment. In a nutshell, for application, you're looking at your online application, you're looking at modeling your CV correctly and appropriately to the kind of jobs that you are applying for. You make sure that you are getting yourself ready and prepared for your interview. For your CV, this is where you have to be generous with your selling points, your achievements, but do not lie. So all the things you have done which are fantastic in your medical school or post-graduation, you have to embellish all of them in your CV. And one other thing about CV is that you have to break it into bits and pieces. For instance, if you did an internship for 12 months, which is a year, and you did medicine, surgery, gynecology, obstetrics, and pediatrics, you can't just write 12 months internship, medicine, surgery, gynecology, obstetrics, and pediatrics. That doesn't make sense. What employer wants to see in your CV is that you are splitting the various jobs you've done to the different duration that you've done them, and what job roles you performed in these various jobs. That's what gives your employer a better understanding of your skill set, so you can be considered appropriately for whatever jobs you're applying. For instance, you can write 3 months, give the date, the period of the 3 months, obstetrics and gynecology, house officer, equivalent of F1, job roles, you did bimanual examination, you did speculum examination, you repaired episiotomy, you were doing venipuncture cannulation, you were doing female catheterization, you were running obstetrics and gynecology clinics, you were doing family planning clinics, or you were doing antenatal clinics. That is how to do a CV. So you've covered 3 months. You go to the next one, general surgery. You say what and what period you did general surgery, what and what you did as a general surgery general surgery doctor, F1 or F2, whatever. So you just have to show details of the various jobs, duration, and your role. That is how to make your CV very marketable to your prospective employers. And did I say you should do multiple applications? Yes. Apply to as many jobs as possible. Some people say apply to minimum of 30 and maximum of 100. Apply many jobs as possible. Personally, I applied to about 5 jobs, just 5 to be honest. And even before I was applying for the 5th one, I already called for an interview. I think what happened was because my CV was a bit special, because I did some programs in the UK and I also did volunteering in the UK. So when they see all these kind of things in your CV, they feel you're a good candidate for the job. During your application, you probably will see where they say upload CV optional. I will advise that whether it is optional or whether it is compulsory, it is always good practice to upload your CV. Upload your CV because that gives whoever is going through the whole sorting out to have a first view of your CV, which represents your personality and your skills, and that can be a good attraction. So the next thing is interview. Most times you might get called for multiple interviews almost at the same time. Sometimes you might just get called for one. You have to now make a decision on which job you really want, and that's the one I think you should pay more attention to in terms of appearing for interview. So when you appear for interview, it's just going to be the normal formal interview that you have gone for all your life. So it's nothing different. The only thing is you just have to make sure that you marshal all your points properly and sell yourself according to what you've written in your CV. So most times you might have a panel of 2 or 3 doctors asking you about your personal experiences, personal achievements, and probably 2 or 3 clinical cases scenario for you to manage, and you just approach it. There might be an emergency case in most of the interviews that you go for, which you just have to use the normal ABCD of emergency management and just go through that. And to appear for interviews, there are books that you can read which specifically talk about the specialty that you are going for, so you know what common conditions and cases that will be asked. So the last thing you want to consider is your contract. So when you've made a decision on what job you want to apply for, private or NHS, if it's NHS, is it training or non-training? Bear in mind that if you want to go training, you have to do the extra interviews and exams again that will eventually qualify you for that training position. What level do you want to start from? There's no harm in you wanting to start from a level lower than what you are used to in your country, because the truth of the matter is that you're coming into a new country, you're coming into a new system, and you're not quite familiar with things. You don't want to be pushed into the deep blue sea. You want to start, crawling before you walk. So you can actually ask to be stepped down, and after a couple of months or at the end of your contract, you can actually reapply for an appropriate level that suits your clinical experience. So yeah, when you get your contract, you have to read your contract properly, ask for advice, or you can even get legal representation to make sure you understand the terms of your contract. So you understand sometimes when you're employed in places like London, you have all those banding, which I don't really understand what those things mean, but I think it's just some extra tiny little amount of money they add on to your salary. It sounds so fancy, but at the end of the day, it might not really be anything worth it. But anyways, there is banding for you to consider. There is also pay protection, but this might not really apply to you if you're coming from abroad. Pay protection will be for those who are already in the country, who have done a couple of jobs already, so they kind of apply to make sure that they don't go below a certain level, a certain salary range. Even if you're coming from abroad for the first time and you're offered a job that you think you should be paid more than that, your employers are very flexible to an extent, so you can negotiate your salary and say, look, I've got this years of clinical experience, I've got this kind of skills, I've got this and I've got that. I don't think this salary is worth my years of clinical experience and what I can offer and bring to the table. So you have that right to negotiate for your salary structure, and most times they actually listen to you and you can get a new contract altogether. In terms of your visa and your work permit, most of the jobs you will be getting will be probably on a tier 2 visa. Some people might get other types of visa, but this is what you have to consider properly and look at it. Make sure you understand everything that is stated in your contract. Lastly is the duration of your contract. If you have in mind to start training, it is best for you to take a very short contract. So you can look at taking a contract of 6 months to 1 year, so that it's not too long for you to be in that particular job role before you switch or move over to your training position. Bear in mind that whatever contract you get, even if it's a 10 years contract, and at some point in the contract or in your job you feel you want to leave, or you feel you've got something better, or your circumstances have changed, you can actually give notice. I think it's 30 to 60 days notice for you to renege on your contract or to end your contract. So these are things that you need to know. Be well informed so that you can make the right and sensible decision. I think I've blabbed enough in this video, but anyways, it's quite difficult to make this a very short video because it's a whole lot of information to pass across, and I hope this has benefited you a lot. If you want to drop a comment, if there's something I've said that you do not agree with, if there's something I've said which is not very clear to you, please just leave a comment and I will try as much as possible to answer. Once again, thank you for joining. Thank you for watching this video. Subscribe to my channel, get this channel up to 1,000 in the next month, and also tap on the bell notification so you'll be the first to know when there's a new video. And if you want to collaborate with me, if you want us to do anything, that's fine. You can get me here, drop a comment, or you follow me on Instagram, Dr. Pepple on Instagram, and yeah, we'll connect. Thank you.